This is Dr. Wes Allison, and today we're talking about issues that may occur around the time of sinus surgery, as well as conditions of the inner ear and ABR testing.
I had nasal surgery to remove polyps and I feel great. My only issue is that I sound like I'm talking through my nose. Any suggestions?
So now that you've had sinus surgery, both air and then sound is likely getting to places that it has never gone before. And that's actually a good thing. That probably means you've had successful surgery. And so this concept of sound traveling through the head is called resonance. And so probably definitely the resonance of your voice has changed. And this is actually probably what your voice is supposed to sound like. And so give it some time. You'll probably not even notice this with a little more time, but if you're still concerned about it, always safe to come back in and let us perform another examination.
I've been told that I have fluid in my inner ear, which is plugged. I get episodes of dizziness, nausea, and feeling like the room is spinning. Is there anything I can do to help with this?
It most likely sounds like you've been diagnosed with a condition called Meinere syndrome. And Meinere syndrome is somewhat poorly understood, but our best belief is that this is actually a buildup of fluid and pressure in the deep inner ear space. So it may help to at least look at some anatomy to understand where this actually is. So if you can look at this poster here, you have, of course, the outer ear and the ear canal, the eardrum, and this is the middle ear space. This is where oftentimes children can get ear fluid, and that's where we place tubes. But what you're describing is likely a condition of the inner ear, where the cochlea and balance canals are. And so this fluid that runs in the inner ear can build up with pressure and cause episodes of vertigo, such as you're describing. So what do we do about this? Well, even though it is poorly understood, we do know that salt and caffeine restriction in the diet oftentimes helps this. There are also diuretics that can be tried as well, and then for very severe cases, there's even medicine that can be injected into the ear, or even surgery that can be performed for this.
I had sinus surgery and I'm still having pains in my face and head. The only thing that seems to help is antibiotics. What can I do?
So the fact that antibiotics are helping your residual facial pain implies that you may very well have residual infection after sinus surgery. So keep in mind, sinus surgery is simply a tool to help with recurrent sinus infections rather than 100% immediate cure. So what we are doing is actually opening the spaces of the sinuses to allow better drainage and to allow better access to medications. So it would be good to go ahead and see your surgeon once more, to have him perform likely an endoscopy to look at the openings of your sinuses and to see if there is residual infection present. What is very common, however, that you may have an underlying condition such as tension headache or migraine headache that is actually contributing this pain as well. So again, good to go back in for a physical exam. That should definitely be your next step.
Does your facility do ABR testing on adults?
So ABR testing stands for auditory brainstem response, and is essentially the measurement of electrical signals from the inner ear to the brain. It is most often used for newborn hearing screens, but yes, our practice does perform these on adults to help diagnose certain ear conditions.